My name's Abby Kelly. I'm wearing a mask and staying 6 feet apart from my friend Melinda, who is filming me today. Okay, so I'm gonna go and get started. All right, so first thing I'm gonna do is check my MAR. I have Anna Povolowski. Her date of birth is 10/06/1957, and she's allergic to penicillin. I'm gonna compare that to my healthcare provider's orders. For Anna Povolowski, date of birth 10/06/1957. Allergic to penicillin, I have 0.9% sodium chloride, which is normal saline. The dose is going to be continuous. I have a rate of 50 milliliters an hour. The route is IV, and the time we're doing it is now. So I'm going to compare this to my medicine. So I have 0.9% sodium chloride for Anna Povolowski. The rate is continuous. Sorry, the dose is continuous. The rate is 50 milliliters per hour. We're doing an IV, and the time is now. Okay, that's good to go. So I'm not gonna go and wash my hands. Hello, my name's Abby. I'm your student nurse today. Can I please just have your name and date of birth?
Hi, Abby. My name is Anna Povolowski, and my date of birth is XXXXXX.
Okay, I see that here on your band. It also looks like, yes, I do have that right here in my computer. And then do you have any allergies I should be aware of?
Yes, I do. I'm allergic to penicillin.
Okay, I see that here on your band. I also see it here in my chart. And what is your reaction to penicillin?
I get a itchy rash all over.
Okay, yep, I see that in here, so we're good to proceed. Okay, so today, Miss Anna Povolowski, I'm going to be giving you your IV solution per your healthcare provider's orders. It's going to be 0.9% normal saline. Okay, do you have any questions about that?
Nope, I do not.
Okay, you feel like you understand everything?
Yes, thank you.
Great, awesome. So the first thing I'm going to do is go ahead and check this site. It's on your lower left arm. Okay, I'm looking for any signs of phlebitis or inflammation, so I'm looking for any redness, any swelling, and do you feel any pain?
No
Okay,
pain.
what about when I press on it? Any pain?
Nope.
Okay, and there's no heat, so we're going to go ahead and move on. I'm going to check the safety of the environment. So the bed is in the lowest position. I have your call light. There's no clutter. The side rails are up. The wheels are locked. Okay, and I'm going to close the curtain. Close the curtain for your privacy. All right. I'm going to go ahead and just wash my hands because I can, because you know. And I'm going to check my IV solution. So here I have IV solution. There is no particulates or any cloudiness, and the expiration date is January 2023. Okay, then I'm going to go ahead and label it with the date, which is 10/29/2020. The time is now. The medication is sodium chloride, normal saline, 0.9%. The dose is continuous, 50 milliliters per hour, and my initials are on it. I'm going to take this over here and compare it. For Miss Anna Povolowski, I have 0.9% sodium chloride, which is normal saline. The dose is going to be continuous, 50 milliliters per hour. The route is IV, and the time you're getting it is now. Magical time of now. Okay, now I have that done. I'm going to go ahead and calculate it. So I have my 50 milliliters divided by my 60 minutes times my drops of 10, which gives me 8.3 drops per minute. We're going to go ahead and round that to 8. Okay, then I'm going to wash my hands. I'm going to open this package, pulling it out. Okay, I'm going to advance this roller clamp all the way up to the top as far as I can get it to go, and then close it off. I'm going to label my IV tubing with the change date order for the next nurse who comes. It's going to be the date 10/29/2020, the time, which is now, and my initials. They know who it is. It's me. It's me. Just kidding. Okay, here's my IV bag. I'm going to remove this, not breaking any sterility, keeping it all really nice. Okay, we're going to remove this safely. So here we are, nice and safe. And I'm going to go ahead and pierce my bag. Again, keeping it all nice and clean. Yay! Okay, we're going to bring it over here and hang it up. All right, I'm going to prime my line. I'm going to keep this nice and filled. Okay, all right, so here we go. Halfway full, good. All right, we're gonna keep this little tab on for my sake. I'm so sorry, this tube keeps going. Okay. Here we are with looking for only 1 to 2 drops. I'm going to slowly open it up. Good. All right, I have those 1 to 2 drops. Close it out. And we're going to hang that up right here. I'm looking for any air bubbles. No air bubbles, get out. Okay, no air bubbles. Third check. So I have my third check over here. We have Anna Povolowski, 0.9% sodium chloride. The dose is continuous, rate is 50 milliliters per hour. The route is IV, and the time we're giving it is now. All of this looks good, so I'm going to bring it back over here. Gonna wash my hands, and we're gonna put on some gloves. Okay, gloves are on. I'm going to go ahead and take this over here, an alcohol prep pad. All right, so we're going to make sure this guy's closed. Come over here. I have this opened up. Okay. Go ahead and open this up. Take it out, remove it. Okay, so I would clean this for 30 seconds using aseptic techniques. Cleaning. And then I wouldn't let this get messed up. Okay, so keeping this nice and clean, not making sure not to touch it with my hands. I'm gonna open this up. And I will go ahead and insert it. Okay, I'm gonna open this up and check for blood aspiration. There is none. We're looking for signs of infiltration, so we're good to go. There is none. We're gonna go ahead and push 3 milliliters of solution through. Nice and slow. All right, and no resistance was met, so we're good on that part. I'm gonna go ahead and open this up, making sure to keep it nice and sterile. I'm gonna grab this over here. I'm keeping everything nice and separated. We're gonna go ahead and take this blue clip off. Okay, and then I would go ahead and connect this onto here. Nice. And we're gonna get some tape and tape it to my patient. If I can get the tape up. All right, we have that here. All right, that's taped to my patient. Then I'm going to come over here and we're going to be doing 4 drops in 30 seconds or 8 in a minute. We're going to slowly release this. Slowly. Release, nice and slow. All right, it's starting to go. I got 1. Okay, so I have those 4 drops in 30 seconds. All right, so I'm assessing the site again for any signs of infiltration or phlebitis. It is looking good. Document any assessments I do. All right, and then I would leave, and when it's done, I would come back, nice and washing my hands. Hello, I'm back. I'm gonna go ahead and close this off. Closing it up. All right, I'm gonna walk over here and put on some gloves. Maybe. There we go. There's those gloves, and then gloves on. Okay. And then I would have all this new equipment, but I'm reusing some of it just because it's what we have. So I have new equipment. All this is new. I come over here with all my stuff. Hello, Anna. I'm gonna go ahead and take this off. I'm gonna have just my red cap ready to go. And again, I would not break sterility. I would keep this in here. We'd open it up. Keep this nice and safe. All right, move this. And keeping this sterile. My thing seems to be like having a little trouble unhooking. There we go. All right, so then I would open this up, and I'm gonna go ahead and connect my red thing, keeping all of this nice and sterile. Good. Okay. I would put this in the trash. All right, hang this up here, out of my way. Okay, then I'm gonna open this up. Get rid of my trash. We're gonna go ahead and clean this for 30 seconds. Then I open it up. Twisting it on, make sure this is closed. All right, and then we're gonna open it up. All right, go ahead and push the 3 milliliters of solution again. Nice and slow. Okay, good, and everything's looking good. Taking this off. All right, and now I clean up the area of any trash or clutter for her. And then I put Miss Anna Pawlowski back in a comfortable position. Are you feeling good? Everything's good, Miss Anna Pawlowski?
Yes, I'm very comfortable. Thank you.
Nice. Okay, we're gonna check the safety of the environment again. So the bed is in the lowest position. You have your rails up, you have your call light. There's no clutter, and the wheels are locked. I'm gonna go ahead and open this curtain. All right, I'm gonna remove my gloves. I'm gonna wash my hands again. And then I come over here and I document what was put into Miss Anna Pawlowski. So she was given that normal saline, sodium chloride 0.9%, 50 milliliters continuously over an hour. And then I would document also like her response to it, which everything was expected, so we're good.